this is adult assessment, so I have all my supplies right here. They're all gathered. Okay, now I'm going to go on into the patient's room.
Hello.
Hi, I'm Amanda. I'm going to be your nursing student for today. Can you please tell me your name and date of birth?
Roy Bender, 11/13/60.
Okay, are you allergic to anything?
Oh no.
Okay. So the reason why I'm here is to conduct a head to toe assessment on you. The reason why we are doing this is because we need to detect any medical abnormalities that you may not have noticed. A head to toe assessment is where I look, listen, and feel on all the parts of your body. So if you're uncomfortable, please let me know.
I will.
Do you have any cultural or spiritual beliefs that may impact my care?
No.
Can you tell me how you've been feeling emotionally?
Feeling really well.
Okay. Can you tell me how you cope with stress?
I go to the gym and exercise.
Okay, that's good. Exercise is really important. I'm going to grab a set of vital signs on you. And grab a blood pressure. Do you have any implanted medical devices?
I know.
Exercise is really good for your physical and mental health. If you eat enough protein, it can help you build muscle. So that's good that you're exercising.
I think it's good.
I got 122/82. Blood pressure was 122/82. I'm gonna wrap the pain assessment, the temperature, the respiratory rate, the oxygen percentage, and the pulse. Okay. I'm just gonna put this pulse oximeter on your finger and measures your oxygen and your heart rate. I'm gonna grab a temperature. This just goes on your forehead. So I got 98.6 for temperature. I'm now going to assess your pulse. I got 18 respirations, 63 beats per minute, 91% oxygen. Can you rate your pain on a scale of 0 to 10, 0 being no pain, 10
0.
being most pain? Okay, you got 0? Okay. So I am just going to ask you some silly questions, but they help me assess your mentation. Can you tell me who you are? Can you tell me where you are?
Awesome.
Can you tell me what time it is?
5 o'clock.
Can you tell me the event or the situation going on?
And your patient assessment.
Okay, so based on his answers to my question, his speech is fluent or monotone, he is fully conscious, he is learn-oriented to person, place, time, event. His mood is calm, and the effect is a relaxed body language. In his auditory acuity, he can hear me speaking at a moderately pitched voice. Okay, so now my general impression. He is well groomed, he's wearing clothes appropriate for the weather. He is sitting at 45 degrees, semi-powers position, and he's not in any immediate distress, and he doesn't have any foul body odors coming from his mouth or his body. So now I'm going to begin my assessment. I'm make sure there are no deformities or tenderness on your head. Have you had any recent falls?
No.
No. Have you hit your head recently? So I'm gonna palpate your head. Okay. No deformities. Are you tender?
No.
So his head size is normocephalic. His head shape is proportional to his body, and his head is symmetrical. His hair, he doesn't have any infestations, and his hair is evenly distributed throughout. Now I'm going to assess your sinuses. Let me know if you're tender. Are you tender?
No.
Non-tender and non-swollen sinuses. So now I'm going to assess your facial movement, function, and symmetry. So I'm going to have you smile real big and frown, and then stick out your tongue. So he had full range of motion on his face, and he had no deficits on his face and no paralysis on his face. His face is symmetrical. So now I'm going to assess your overall appearance. So you appear well groomed, you're not in distress, you're not tripoding or breathing heavy, and you appear relaxed. So now I'm going to assess his eyes. So I'm going to shine this light in your eyes to help me assess the reactiveness of your pupils. I'm going to have you focus on my pen close to your face and then focus on something behind it. So his pupils were equal round, reacted to light and accommodations. I'm looking at all parts of his eyes. So his eyelids, his conjunctiva, his sclera, and his pupils. His eyelids are not swollen, his conjunctiva is pink, his sclera is white, and he doesn't have nystagmus or strabismus present. So now I'm looking at your nose. I'm going to assess the air patency of your nose. His skin on his nose is clean, dry, and intact, and the color is appropriate for ethnicity. His mucous membranes are moist. Now I'm going to assess the patency. I'm going to include one of your nostrils, and I'll be breathing through the other. So his air is patent. So his nares are both patent. So now I'm going to assess your ears. So I'm going to put a piece of gauze in your ears. I'm not putting it in as you would say all the way. I'm just putting some gauze in your ears to assess for drainage. So I'm going to have you turn toward your right. So I'm looking at skin integrity on his ears. There are no lesions. His skin is clean, dry, and intact, and the color is appropriate for his ethnicity. I'm going to palpate for tenderness. Are you tender?
No.
Okay, I'm going to put a clean piece of gauze in your ear. There's no drainage present. Okay. Now you can turn the other way. So the skin on his right ear is clean, dry, and intact, and the color is appropriate for his ethnicity. There are no lesions. And I am going to palpate for tenderness. Is that tender?
No.
I'm going to put this gauze in your ear. There is no drainage coming from his ear. So now I'm going to assess your mouth. So I see that your lips are pink and moisturized and not cyanotic and dry. So now I'm going to have you open up. So his mouth is moisturized. His uvea is midline, his gums and his tongue and his flesh is pink. His dentition is well groomed. He doesn't have any chipped teeth. His mouth is moisturized. There are no lesions. His skin is clean, dry, and intact. And do you wear dentures at all?
No.
Okay. So, do you have any concerns regarding your mouth, your nose, your eyes, your head, or your ears?
No.
Do you wear glasses?
This is
How are those working out?
fine.
Okay. And you can see adequately while you're driving?
Yes.
Okay. So, have you experienced any hearing loss?
No.
Okay. Have you experienced any headaches?
No.
Okay. Has your mouth been hurting? Okay. So now I'm going to assess his neck. On inspection, I don't see any swollen lymph nodes. His trachea is midline. There's no masses, Gaudier, or JBD. So now I'm going to palpate your carotid pulse. So I'm going to have you turn towards your right. Carotid pulse is present. There's no GB. Alright, now you turn the other way. Carotid pulse is present. There's no JBD. The carotid pulses were both 2+, moderate bilaterally. Now I'm going to palpate for swollen or tender lymph nodes. Okay, let me know if you're tender or me palpating is painful.
Okay.
Are you tender? Okay. Non-swollen, non-tender lymph nodes. Now I'm going to palpate for masses. There are no masses or deformities. Were you tender?
No.
Have you had any problems with your throat?
No, none.
Have had any difficulty swallowing?
No.
Okay, so now I'm going to assess your arms. So I'm inspecting your arms. So there are no deformities. Your skin is clean, dry, and intact. And the color is appropriate for his ethnicity. So I'm looking at your arms. The color is clean, dry, and intact. And color is appropriate for ethnicity. Okay, there are no deformities present on both arms. Your joints are non-swollen and your fingernails are not clubbed. Your joints are not swollen and your fingernails are not clubbed. Okay, so now I'm going to do circulation. So he is warm to the touch bilaterally. I'm going to assess bilateral radial pulses. Equal, 2+, moderate. And I'm going to assess capillary refill. Capillary refill was less than 3 seconds on all 5 fingers on his left hand. Capillary refill was less than 3 seconds on all 5 fingers on his right hand. So now I'm going to assess your motor function. So can you use my hands? Okay. Equal grip strength and his muscles are even and symmetrical. Now I'm going to have you do this. He has full range of motion on his fine motor skills. Now I'm going to have you sit up. Okay, I'm going to have you go like this, and then do arm circles. So he has full range of motion on his gross motor skills on his upper extremities. And now I'm going to assess your sensory. So I'm going to have you close your eyes, and I'm going to touch one of your fingers, and you're going to tell me what finger I'm touching.
Thumbs.
Okay. So now I'm going to palpate. So I'm going to assess for edema. There is no edema present bilaterally. Okay, now I'm going to palpate for tenderness and lumps and deformities. Are you tender?
No.
No tenderness, no lumps, no deformities?
No.
Okay. How was that?
Good.
Good, no
No
tenderness?
issues.
Okay. No tenderness, no lumps, no deformities. So have you had any joint stiffness or pain in your upper extremities?
No.
Do you have any concerns with your upper extremities?
No.
No? Okay. Now I'm going to do his back. So I'm inspecting the skin integrity and color on his back. The skin is clean, dry, and intact. The color is appropriate for his ethnicity, and he is warm to the touch. His spine is within midline. There are no cervical scars or kyphosis. Now I'm going to palpate for tenderness and lumps. Are you tender?
No.
Okay. No tenderness and no lumps. So have you had any back pain recently?
No, I haven't.
Do you have any concerns regarding your back?
No.
Okay. Well, I'm going to have you lay back down. I'm going to assess your chest. So his work of breathing is non-labored. His chest rise and fall is equal, symmetrical, and his work of breathing is non-labored. He's not using his accessory muscles. He's not tripoding. His positioning is at a 45-degree angle. I'm going to now look at his skin integrity. So he has no port or no pacemaker. His skin is clean, dry, and intact. No port or no pacemaker. The color is appropriate for his ethnicity. And I do see that he's not using accessory muscles. I'm going to palpate for lumps. No lumps present. Were you tender?
No.
You have equal and symmetrical chest rise and fall. So now I am going to listen to your heart sounds. So aortic at the second intercostal space on the right hand side. This is pulmonic second intercostal space on the left hand side. This is first void third intercostal space left hand side. This is tricuspid at the fourth intercostal space left hand side. At the fourth intercostal space. And this is mitral or bicuspid at the fifth intercostal space on the left hand side. Okay. Now I'm going to listen to the point of maximum impulse for 60 seconds. So S1 and S2 were present, and the heart rate was regular in rhythm and not ready. So now, have you had any chest pain recently?
No, yes.
Have you had any concerns regarding your heart?
No.
Okay. So now I'm going to listen to your lungs, so I'm going to have you sit up. So I'm going to have you breathe normally. If you feel like you're going to pass out, you can go ahead and lay back down. His lung sounds were clear bilaterally on the anterior aspect of his body. So now I'm going to listen to your lung sounds on the posterior aspect. Just breathe normally. So his lung cells were clear bilaterally on the posterior aspect of his body. So do you smoke at all?
No, yes.
Okay, that's good that you're not smoking. Smoking can cause COPD, which is called chronic obstructive pulmonary disease. That can compromise your oxygen levels in your blood and really hurt your body. So it's good that you're not smoking. Keep up the good work.
Okay.
Okay, so now I'm going to assess your abdomen. So I'm going to have you lay back down. Okay. So have you had any concerns
No.
with your bowel movements at all?
No.
Okay, how regular are your bowel movements?
The morning and every day.
Okay, what do your bowel movements look like?
Solid.
Okay. I'm going to now inspect your abdomen. So I don't see any hernias or deformities. His skin is clean, dry, and intact, and the color is appropriate for his ethnicity. I'm I'm now going to auscultate his vowel sounds in the right lower quadrant before I palpate, because if I palpate, that can cause false vowel sounds, so I have to auscultate first. He had active vowel sounds in all 4 quadrants. If they were hyperactive or absent, I will listen for up to 5 minutes in each quadrant. Now I am going to palpate. Let me know if you're tender. Are you tender?
No.
Okay. Yeah, no tenderness and no rigidity. When I auscultated, I would touch my stethoscope to his skin, but since he's uncomfortable with that, I listened through his shirt. So now I'm going to palpate your bladder. Let me know if you're experiencing tenderness or pain.
No issue.
Okay. His bladder was not distended, and he did not have any tenderness or pain. So now I'm going to do my GU assessment. I'm going to ask him some subjective questions first. So have you been experiencing a rash in your perineal or your
No.
private part area? No. Can you tell me about how your urine characteristics?
Pale yellow.
A pale yellow? Okay. Okay. Now I'm going to look at your genitals. So if you're uncomfortable with that, please let me know. So I'm looking at his genitals. I'm going to look for any parasites, skin breakdown, any foul odors or discharge. And I'm going to also note how clean he keeps himself. So there are no parasites present. He has good hygiene. His skin is clean, dry, and intact, and the color is appropriate for his ethnicity. There's no foul-smelling odors or drainage present, and there are no lesions or deformities. I'm going to turn you on your right. 1, 2, 3. Okay, I'm looking at his coccyx, his lower back, his buttocks, and his perineal area. There are no parasites. There's no foul-smelling odors or discharge. He doesn't have any deformities or lesions. His skin is clean, dry, and intact with no rashes, and the color is appropriate for his ethnicity, and there are no parasites present. I'm going to put you back down. There's no rash or deformities on him either. Okay. So now I am going to look at your lower extremities. If you can pull up your pants, please. And thank you so much. Okay. I'm feeling his temperature. He is warm to the touch bilaterally on his lower extremities. How often do you shower?
Really.
Okay, that's good. Keep on showering. It helps prevent infection with your genitals and your skin. Okay, now I am looking at your skin integrity. So your skin is clean, dry, and intact. There are no deformities, and the color is appropriate for the ethnicity. So this skin is clean, dry, and intact. The color is appropriate for ethnicity. There are no deformities. Now I'm going to assess swelling. There's no pitting edema present. His muscles are even and symmetrical in size. So now I'm going to assess his circulation. So his dorsalis pedis pulses are even bilaterally moderate to plus. His posterior tibial pulses are even bilaterally moderate to plus. So I'm looking at his toes. His toes are well maintained and well groomed. He doesn't have any swelling of the joints and any clubbing. So now I'm going to do his capillary refill. was less than 3 seconds on his left toes, on his left hand side. So now I'm looking at his toes here. So he doesn't have any swelling of the joints. His toenails are well maintained and not clubbed. I'm going to do the capillary refill now. Okay, so his capillary refill was less than 3 seconds on his right foot for all 5 toes. Now I am going to do sensory, so I'm going to have you close your eyes and you can
Okay.
tell me what toe I'm touching.
Big toes.
Okay. And now I am going to palpate for lumps, lumps and deformities and tenderness. Are you tender?
Yeah.
No lumps, deformities, or tenderness present. No swelling. Okay. Palpate for lumps, tenderness, and deformities. Are you tender?
Yeah.
Okay. No tenderness, no lumps, no deformities, and no swelling. So his muscles are equal in size and shape and symmetry. So now I am going to have you be prepared to walk. I'm going to assess your function now. You can go ahead and sit back down.
Sorry.
So can you push on my feet like a gas pedal? Pull up. Okay. So his he had equal strength in both of his feet. So now you can walk. His gait is independent and steady. Do you use any assistive devices while you walk? Do you experience any pain or unsteadiness while you walk?
No.
You can go ahead and lay back down. Do you have any concerns for me
No.
regarding all your body parts? No? Okay, so here's your call light.
Thank you.
Your bed is in the lowest position. Okay. Bed locks are locked. Here's your personal belongings.
Thank
Do you need anything else? You're welcome. Okay. So, let me know if you need anything. I'll be right back. I sanitized my hands, and now I'm going to document everything I did, and my skill is complete.